What's up, YouTubers, and welcome back to another MicroVid. I'm Dr. B, and in this MicroVid, we're going to be talking about respiratory diseases. We're going to be talking about restrictive versus obstructive diseases, okay? So I'm going to go ahead and share my screen, and we'll jump right into it. So before we talk about the intricacies of restrictive versus obstructive, let's just kind of define, like if you're sitting at the dinner table and your mama asks you, hey, honey, what's the difference between a restrictive, that's a horrible voice, but restrictive and obstructive disease. Restrictive diseases, right? People with those have, or patients with those, they have problems inflating their lungs, okay? They have very difficulty expanding their lungs enough to get a decent amount of breath, and because there's so much restriction going on there. And we'll talk about a little bit later the different types of restriction that can occur there. But regardless, restrictive patients are ones that have difficulty breathing, right? They have difficulty inhaling. Obstructive, on the other hand, are patients that have difficulty blowing out, right? They don't have a problem inhaling, they have a problem exhaling. Okay, and so it kind of goes down to this, right? We've talked about before. You've got a lung recoil that is inward due to surface forces and due to the natural elasticity of the lung. You've got an outward lung recoil, okay? And so the example that I gave in class was, okay, say if these are your lungs, right? They're normal lungs, and you're expanding, you're inhaling, exhaling, exhaling. Say you've got 3 rubber bands around your lungs normally, right? You're stretching them, then they're gonna recoil, right? You're inhaling, you're exhaling. Well, with someone with restrictive lung disease, whatever kind they have, instead of 3, they have 5, right? So now they've got 5 rubber bands, and now it's a lot harder to inhale, and then they can actually exhale more in terms of bringing it to a lower residual volume, okay? Because they got 5 rubber bands out, so they're able to squeeze actually a little bit more air out than a normal individual. Not more volume air out, but actually bring it down to a lower residual volume level. Okay, that's restrictive. Obstructive is the opposite, right? So if you've got normally 3 rubber bands, and now you've got an obstructive disease, now instead of 3, you just have 1. So you actually have a really easy time expanding, right? The elasticity when starting from a smaller lung volume is actually really it's super easy compliance, right? So there's a lot of compliance in someone with emphysema, for example, or an obstructive disease. But the issue is they only have 1 rubber band, so they have a problem exhaling and bringing it to a lower lung volume to get the air out. So they're kind of 2 diseases, emphysema and pulmonary fibrosis, on opposite ends, whether we're talking about restrictive or obstructive disease. So let's go ahead and look at what we're sharing right now. And what I'm sharing right now is looking at the restrictive and obstructive in terms of their FEV. Okay, so right here, first off, I want to draw your attention to this, right? So we've got a normal individual right here on the left, then we have obstructive right here, that's O, and then restrictive over there, okay? So look at the FVC, that's forced vital capacity, or the total amount of exchangeable air as fast as possible. So that's a maximal inhale, and then you blow out as fast as possible, as much air as you can. That's forced vital capacity. If you look at the delta right here, the forced vital capacity of a normal individual is larger than not only the obstructive forced vital capacity, but also the restrictive, okay? So just know that a healthy individual can have a larger, and oftentimes does have a larger total forced vital capacity volume capacity than the obstructive and the restrictive. Okay, so now we're looking at FEV1, that's forced expiratory volume in the first second. And if we look at a normal individual right here, they can get out about maybe like 70 to 80%, right? 70 to 80%, maybe even 85% of their total FVC, right, in the first second. That's what FEV1 is. It's forced expiratory volume within the first second. So they can push out the majority of their total amount of exchangeable air in the first second. If we look at obstructive disease patients, not only do they have a smaller FVC, okay, but if you look at their FEV right here, they're not able to push out all that much of their total amount of exchangeable air in the first second. In fact, someone with an obstructive disease would have something that's actually less than 70, right? Maybe it's like 60, maybe it's even 50% of their total total amount of exchangeable air are they able to blow out in the first second. So that's obstructive. And it makes sense because remember what we said at the beginning, people with obstructive diseases have a problem exhaling because they don't have as much of that natural elasticity that contributes to lung recoil. Restrictive is kind of the opposite, right? With restrictive diseases, they're actually able to exhale either just as much as a normal person or more than a normal person in the first second. So we see in this example right here, this FEV1 in the first second in this patient, they get almost all of their FVC exhaled within the first second. So we're going to say like this is like almost 90% right there. If you look at FEV1 as a percentage of FVC, okay? So it's important to understand, what these diseases are doing and how they're going to affect FEV and FVC, okay? So that's just an example right here. Let's go on to the next slide. I think I talk about this one right here, right? So if we're looking at patterns, okay? So, and I'm not going to go through every one of these points on this chart because you can actually, go through and read them. But obstructive and restrictive are going to be doing different things because physiologically speaking, depending on the, what's causing an obstructive pattern or a restrictive pattern, it's going to cause different things, right? So TLC will go up with obstructive, that's total lung capacity, and it's going to go a lot down with the restrictive. FEV1 is definitely going to go down with obstructive. We saw that, and it's going to decrease with fibrosis, pulmonary fibrosis as well. Both of those are decreased, right? When we're talking about the volume, not necessarily the ratio, but the volume. This right here on the left, the FEV1 to FVC ratio, is something different. We're looking at now at FEV1 in comparison to total amount of exchangeable air. We see that with obstructive, that's going to go down, but with restrictive, that will actually go up. It can be normal, but generally speaking, in the prototypical restrictive pattern, it will go up and increase. Okay. All right. So you can look at those. Let me see what else there is. I think that might be it for this MicroVid. Let me go ahead and bring it back to stop sharing my screen. Please let me know if you have any questions or comments, or if that explanation didn't sort of explain it fully enough to sort of get that aha moment, or if you feel like you're still not getting what I'm expecting you to know. Please let me know. As always, stay cool, stay in school, don't do drugs. Peace.